Fat grafting has gained a lot of popularity recently. In the past, plastic surgery procedures aimed to be subtractive, take fat out, tighten, pull. All of that has changed. We understand now that fat actually gets deflated over time and we lose volume. It's sort of like a grape that's turning into a raisin. So in the past, when you used to just think about tightening and pulling, we don't want to do that anymore. And that's why fillers are so popular. So we want to fill, resuspend, create that projection, that youthfulness. Now, fat is popular for two reasons. One is that it's a natural substance. It's coming from your body. And the second is that it's something that is thought to last longer. There's issues with fat though. Depends on the quality of your fat. So some people, you have fat that's a little higher quality, some it's not. There's a lot of considerations. Now, whether it is a good option for you will depend on unique medical factors and facial aging factors that we'd be happy to chat with you more about when you come in and see us. The best candidates for autologous fat grafting are those who really want to use natural substances. They don't want fillers, they don't want chemicals. They want to have the volume, they want to improve the deflated areas of their face, but they want to be as natural as possible. Really, we're looking for patients who have a great, pristine medical history. So if you have diabetes, if you're smoking, if you're on a lot of medications, we tend not to advise autologous fat grafts because the graft may not give us the result that we all want. So if your medical history is clear and you're a good candidate, certainly it's a great adjunct in our facial rejuvenation armamentarium. Fat grafting is associated with more swelling than we would expect with surgery or with the hyaluronic acid fillers that are non-invasive. The fat tends to get very swollen early on, and then it tends to get resorbed, at least 25% in most surgeons' hands. So it's an interesting intervention. For the first few months, some people love the result because they've got the volume expansion and the swelling actually gives them a beautiful look, but then that goes away and they thought, hey, I got this fat graft, but now it's gone, what happened? Other patients actually don't like it because you have the fat that's very swollen, and it's swollen for a long period of time, and then by the time it looks good, it's like 6 months have passed. This is my honest experience, and most surgeons who use this in any consistent way will tell you these are the things that as the surgeon we have to balance for you. We have to communicate this to you in an honest way, tell you what the pros and cons are so you know exactly what to expect. And if you're a good candidate, certainly it is a very good option, but it's not for everyone.